Assalamu alaikum, hello and welcome to The Health Show, here only on the Islam Channel with me, Alistair Greena. As you know, every week we're joined by a health expert within their specialised field and discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, The Health Show offers an alternative viewpoint from our health experts who attend the show, to help guide you in the right direction. And if you'd like any further information on our programme or any of the topics we discussed throughout the series, please do get in touch at healthshow@islamchannel.tv. That's healthshow@islamchannel.tv. Today we'll be looking at strokes. Now, a stroke can happen to anyone, but there are some things that can increase your risk of a stroke. It's important to know what the risk factors are and what you can do to reduce your risk. We're pleased to welcome the Stroke Association to the show today, a UK charity that works to prevent strokes and to support everyone affected by them. They fund research and campaign for the rights of stroke survivors of all ages. To discuss today's topic, it's a pleasure to welcome Michelle Dalmasio, who is the Stroke Support Zone Director for the South of England. Hello, Michelle. Thanks for coming on the show.
Thank you for having me, Alistair.
Lots to talk about and an incredibly important subject, so thanks for being here. Before we talk with Michelle, the How to Do the FAST test video runs through each stage of the FAST test to help you identify the most common signs of a stroke. It's really important to learn how to do the FAST test and to share it with your friends and family. Recognising the signs of a stroke and calling 999 is crucial, even if the symptoms pass. The quicker the person arrives at a specialist stroke unit, the quicker they'll receive the appropriate treatment. If you learn it and share it, you could save a life.
So how's the new job going?
Absolutely fantastic. Closer to home, so I get to spend more time with Shamila and the kids.
You worked hard for it though, mate.
Well, no.
Are you alright? Is he alright?
Steve? I think he's having a stroke. We need to do the FAST test. What? How?
Wait a minute, Steve, what's wrong?
Steve could be having a stroke. It's time to do the FAST test.
F face. His face has fallen on one side. Steve, can you smile for me?
F. Face. Look at the person's face and ask them to smile. Has their face fallen on one side?
A. Arms. Can you raise your arms for me?
A. Arms. Ask the person to raise both arms and keep them there. Are they unable to raise one arm?
He can't raise his other arm. S. Speech. Can you say hello and tell me your name?
S. Speech. Ask the person to say hello and tell you their name. Is their speech slurred?
Hello,
Tea time.
T. Time. Steve is having a stroke. It's time to call 999.
Ambulance, please.
Be alright, mate.
Steve has shown all three of the FAST symptoms, but even one of these symptoms could mean someone is having a stroke. If you suspect a stroke, do the FAST test and always call 999 straight away if you see any one of these signs. Learn it. Share it. You could save a life.
Michelle, it's great that you're here from the Stroke Association, and obviously that's a really important video that you share with people. It's incredibly simple, but it must make just the world of difference if people follow those particular courses of action.
Absolutely. So if somebody's having a stroke, in essence, there's damage being done to the brain. So the sooner people seek help, the better kind of recovery and outcomes for them afterwards. So people shouldn't feel kind of not embarrassed or, not wanting to cause a fuss. Stroke is a serious condition, so if you suspect someone of having a stroke, you should call 999 and get them the medical attention they need urgently.
And that's the real key, isn't it? It's if you're in any doubt, Because at the end of the day, if it's a genuine feeling that you have that there's a possibility of someone having a stroke, that's the point that you should take action.
Absolutely. So time is crucial. So there are certain kind of treatments that people may be eligible for, which will result them in, perhaps having less degree of disability or no disability, following their stroke, where it's time sensitive. So if there's too much time that has passed, you might not be eligible to get the optimal treatment that, you could benefit from.
And is every hospital geared up in terms of knowing that if you phone 999 and you call the emergency services and you say, we've done the fast test, we think there's some of these signs are showing up, we think this person's having a stroke, do they automatically then they know what to do in terms of following a certain procedure?
Yes, so the ambulance services will know which hospitals in the local area will have that specialist stroke unit to have the required machines for the proper scans to be able to diagnose it. So that's another thing. You might live next door to a hospital, but if that isn't a specialist stroke unit, you are not benefiting. So even though you're calling 999, they would know to bring you to the right place for the best
So
treatment.
as soon as they hear that word, and it is about time, but sometimes when people are faced with the trauma of seeing someone suffer like that, everything goes out the window, people forget things. Are you finding that FAST is a good campaign in terms of people are remembering it?
Yes, so since the FAST campaign has launched, there are more calls going into 999, which has resulted in people, getting the best treatment as quickly as possible. And that, does help save lives, and that does help, people recover, better and have less impact following their stroke. So it is a good message to know and share, because you really can save a life.
And again, just before we get back to the basics of how a stroke happens, what causes it and so on, give me an idea of the difference that time can make. You said earlier on that, it could affect people's eventual disability, their recovery period and things. Give me an idea of what difference timing can make to someone's recovery.
So the thing to understand about stroke is that there are no two experiences that might be exactly the same. So when we get to talk about kind of what a stroke is, but it is kind of damage within your brain. And depending on which part of your brain has been affected, that some common things would be physical disabilities following. You may have difficulties, as was shown in the video, moving your arms, moving your leg. You might have kind of one-sided body weakness. Speech will be affected. Some people might have problems with communication over many, many, many years. Some it might come back quicker. Some might not ever have it the same or be able to speak. So the treatments could result, for example, if you can get, the best optimal treatment right away, you might be in hospital for less time. You might be able to get out of bed, move about, return to work. So you might return to kind of daily activities and be more independent. So the longer you are not treated for, and depending on where your stroke has happened, the more kind of devastating the...
Are you saying, therefore, that the stroke happens, but the damage actually continues in the moments after the physical stroke happening?
So a stroke is either kind of like a bleed in the brain or a block in the brain. So during this time, there is oxygen that isn't getting around to kind of circulate around your brain, which your body needs. So the longer your brain is deprived of this oxygen, then the more, devastating the impact of your stroke can be. So which is why time is crucial. So if you can be supported to get that, oxygen flow through your brain quicker, the better it is for you.
And to give us an idea of that whole process, we're going to be joined in the second half of the show by Rebecca, who will tell us exactly what it's like from a patient perspective. Let's get back to real basics. So first of all, define a stroke. What actually is happening?
So a stroke is, the loss of oxygen to your brain, and it's caused by one of two things. So it can either be a clot, which is called an ischemic stroke, and most of the strokes are due to the ischemic due to the clot in the brain. Another type of stroke is a hemorrhagic stroke, and that's where it is as a result of a bleed in the brain. So that is less common, but often the after effects of a hemorrhagic stroke is more devastating. So people might experience a greater degree of disability following one of those strokes.
And what sort of age groups are normally affected? We tend to associate it with something, with people of an older age. Is that true?
So age is a risk factor. So as you age, your risk for having a stroke is greater. However, increasingly, people of younger ages are having strokes. So at least a quarter of people experiencing strokes are of working age. So, it is something that could impact, your family. If you've got a young family, I mean, if you're having it in your 30s or your 40s or your 20s, I mean, it could happen at any age.
And as soon as this blockage happens, what then is taking place in the body? We talked earlier on about the brain being starved of oxygen and so on. Talk me through the process of what happens, if you like, almost like on a timeline, once that stroke happens.
Okay, so when you have been, so you've got the block or the clot, and, there are brain cells that are not receiving oxygen, so they are, in essence, dying. And when you get to hospital, what they're doing is they're kind of assessing you for the best treatment possible, and there are different kinds of treatments. What they want to do is they want to remove the clot or the block. They want to clear the way so that the oxygen can flow. So there is a treatment called thrombolysis, where they kind of inject the medicine or whatever, and it breaks apart the clot. And then there is a newer treatment, it's called thrombectomy, where in essence they kind of insert a little basket through a vein in your groin, and they pull out the clot. So you might have a little bit of try and break it up and then pull it out. So those are the best treatments available. Not everybody's eligible for that type of treatment. It could be if you've had a bleed, you might have to go in for kind of surgery to, correct the bleed. So there are different options available.
And at the Stroke Association, we mentioned in your introduction that you're involved very much in obviously helping survivors, raising the campaign to prevent strokes in the first place, or certainly prevent them becoming too serious. Are you involved in some of the treatments and things for strokes as well?
So we, in terms of treatments, we fund research that will kind of test out best, treatments or new treatments for patients, but we're not treating people clinically. We're not providing therapies. What we do is we provide support to people, after they've had their stroke, or we provide support to families to help them understand what has happened to their family member, get more information to prevent further strokes. So some people will have more than one stroke. So understanding what you can do to reduce your risk of having another stroke is another important thing that we do.
Well, let's talk about that, the
Sure.
prevention of a stroke, because I know, again, that's something you're very much involved in. So first of all, what causes it? What are some of the risks? And then we'll talk about what we as individuals can do. So what are those big risk factors?
Okay, so I'd previously talked about age. As you grow older, your risk is higher. And controlling your blood pressure. So having a healthy blood pressure is really crucial to reducing your risk of having a stroke. So a lot of strokes can be prevented by just having, a healthy blood pressure. So getting checks, if maybe you don't go to get your blood pressure checked regularly, that could help you. Other things such as lifestyle, like having a healthy lifestyle, engaging in, active, exercise, eating a healthy diet, not living kind of that sedentary lifestyle, and also certain health conditions. So if you have high cholesterol, that puts you at a greater risk of having stroke. If you have diabetes, that also puts you at risk of having a higher risk of having a stroke. If you smoke, if you, drink too much, or you engage in, substance misuse, that is also a risk factor.
So the good news is a lot of these things, it's quite easy to remedy in our lifestyle, isn't it?
Yes.
And what about the Black, Asian, ethnic minority groups? Are they more susceptible to strokes or about the same as everybody else? Is there any difference?
So, people from like Black and minority ethnic groups, particularly South Asian as well, they are at higher risk of having a stroke. It could be due to the fact that they are more susceptible of having higher blood pressure. Part of that might be linked to kind of diet. But yes, so it is more important. I mean, it's important for everybody to make sure they're, on top of, their cholesterol, knowing their blood pressure, that sort of thing. But they are at a higher risk.
So something to be aware of, and certainly you mentioned diet there, and that's obviously very much a key part. And it seems to be most preventative measures come down to diet and exercise when it comes to lifestyle and for the things that people can do something about.
Absolutely. And kind of following this, healthy lifestyle it's not just going to prevent strokes, it will prevent, diabetes, it will prevent heart disease. So kind of generally that is good activity to kind of be part of and live your life in a certain way.
And what about your chances of having a stroke if a family member has had a stroke? Is there an hereditary element to this?
Yes, so potentially if you've had other family members that have had strokes, that may increase your risk. If you have particular other like heart conditions, like atrial fibrillation is one of the biggest risks for people that might have those hemorrhagic strokes, the less common, often more devastating type of stroke. So generally being aware of your health and seeking support to make changes, if that's what you would like to do, is very positive.
Which makes perfect sense. Let's talk about the treatments now. So someone's been admitted into one of these specialist units. What then happens?
So after they've kind of, I suppose, stabilized, either the bleed or, the clotting and cleared the path, part of it is supporting people to kind of rehabilitate and try and recover following the stroke. So as I mentioned, they may have difficulty moving their arms or legs or hands. So you would get support from a physio. Potentially you would get support also from a speech and language therapist because it can affect your communication. It could affect, your swallowing, you being able to kind of eat. People might have difficulty kind of like even with numbers and words, various things.
So because it's connected with the brain, are you effectively having to reteach the brain, or are you actually using another part of your brain to learn these skills to replace the ones that you've lost?
So, yeah, I think that's quite interesting. So we talk about this thing called neuroplasticity, where your brain can relearn things. It might be adjacent kind of cells to the ones that were damaged, where you can, potentially relearn. Many people relearn how to walk or, end up speaking again. But, you asked what other kind of therapies people might receive. They would also get input from an occupational therapist if people are thinking of returning back to work or being in their home independently to kind of, dress themselves, make a cup of tea. Like some of those things might all have to be relearned. You might have to modify how you cook your dinner if you've got limited use of one arm. You might see a psychologist. A lot of people will experience kind of emotional and psychological difficulties after a stroke, a dietitian,
And what about your chances of a full recovery? Is that something that can happen, or are you going to be left with some remnants of the stroke?
As I mentioned, everybody's experience of stroke is different. Some people will walk away with limited kind of after effects of having a stroke. However, stroke is the leading cause of adult disability in the UK. It is the fourth leading cause of death in the UK. So the after effects of it is quite serious. So there are many people that are left with disability following stroke and having to adapt and live life, making adjustments to the
And we'll be talking to Rebecca a lot about that and how you adapt, and hopefully getting some really good advice for people who may be living with someone who has been through this experience as well. Obviously completely life-changing, but again, to stress just before we go to our break, again, the whole point of your campaign is to increase people's awareness, but also, most importantly, to know what to do should they suspect someone is having a stroke.
Yes, absolutely.
And remind us very quickly before we go to break exactly what it is we should be looking for if somebody we suspect is having a stroke.
So the FAST test is, the F stands for face. So is one side of their mouth drooping? So it could be their mouth, it could be their eye. So that's the F. The A is arms. Can the person raise both of their arms over their head and keep them there? So S is for speech. Can the person speak, coherently? Can they understand what you're saying? So it could be that they can speak, but they're not understanding. So that's speech. And if you recognize any one of these three symptoms, T is for time, to call 999 to get them the urgent medical attention that they need.
Michelle, thank you very much. We'll talk a lot more in the second half and again remind people again what they should do. And we'll also be talking to Rebecca as well, who has been through this whole process to get a different perspective on it. But for the moment, thank you very much. It is time for a quick break now. But as always, we must stress that should you suffer from any medical problems or have any health concerns whatsoever, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Don't go away, we'll be back shortly. Welcome back to the Health Show, where our topic today is strokes. Joining us for this part of the show is a stroke survivor, Rebecca Nightingale. Hi, Rebecca. Thanks for joining us.
Thank you.
Great to see you, and we'd love to hear your story. But before we do hear more from Rebecca and her remarkable story, we'd like to tell you more about the seriousness of the condition for stroke sufferers. According to the Stroke Association, each year around 100,000 people in the UK have a stroke. Half of all stroke survivors are left with long-term disabilities, which means the demand for ongoing care and support for stroke survivors continues to grow. The Stroke Recovery Service provides tailored long-term support for stroke sufferers. It starts in hospital and continues once they're at home. The short animation describes the journey of one stroke survivor and demonstrates how the service supports him and his family along their stroke recovery journey. Let's take a look.
Charlie has recently had a stroke. He joins around 1.2 million stroke survivors living in the UK. And Charlie is in the half of all survivors left with a long-term disability. He's in hospital. The world has changed for both him and his wife, Rose. His stroke has left him paralysed down one side. He also has aphasia and finds communicating or being understood very hard. He's referred to the Stroke Recovery Service and meets Ruby. She talks with them and helps them understand what has happened and what their choices might be. When Charlie is ready to be discharged home, Ruby does an assessment to look at any immediate risks of readmission. At the Stroke Association, we have over 30 years' experience of working with stroke survivors and their families. We understand stroke and how it totally changes lives. We are there for people such as Charlie and Rose. Once Charlie is back at home, Ruby visits them to see how things are and to find out if they need anything. She listens to Charlie and Rose and hears about their emotional, physical and practical needs. She helps them complete a holistic assessment and agrees a recovery plan with Charlie and Rose, which is focused on their personal goals. Ruby refers Charlie to the exercise-based stroke rehabilitation service to improve his overall fitness and function. Rose also needs support. It's not easy coming to terms with a loved one suffering a stroke, and Ruby refers her to one of our counsellors and for further carer support. Ruby reviews how they're getting on. Ruby discusses with Charlie meeting other stroke survivors and volunteers to practice communicating in a safe and supportive environment. Charlie enjoys this and feels he's making progress. She also introduces him to My Stroke Guide, which he can use on his tablet or PC. This digital tool will help him self-manage and monitor his goals to adjust to his life after stroke. At 6 months, Ruby undertakes a thorough review looking at what Charlie has achieved and any changes in the support he and Rose need. After a 1-year review, Charlie has made enough progress and is feeling ready to support himself with the help of the other stroke survivors he's met through his local stroke community and stroke support group. And he knows he can call on Ruby if he's had a bad day. For more information on the Stroke Recovery Service and how we can support stroke survivors in your area, visit stroke.org.uk.
So, Rebecca, thank you again for joining us. And I'd really like to hear a little bit more in a while about your interaction with the Stroke Association, because it's great to hear all of that incredible support that's available for you and your family, and not just the physical support, but also the emotional support as well. But maybe start off by just telling us your story of what happened.
It started off like any other day. Went to work, was absolutely fine, did the whole day at work, and it was on my way home from work. I didn't even feel ill. And I was on the tube, and all of a sudden I just got the weakness down one side. Thought, oh, I'm being silly. Because I suppose at my age, you still don't really think about stroke. And I carried on thinking, yeah, I'll be all right. And it got worse. And it was lucky that the actual London Underground staff helped me. And they actually got me an ambulance.
Again, this is training of the London Underground staff that possibly saved you.
Absolutely, because at one point I was actually, I'm just going to go home, and I'll go home and have a lie down and I'll be fine. And my partner was out, and by the time he got home, and he might have found me later on, it could have been a completely different situation.
And at what point did you realise that you were having a stroke? Was it when the London Underground staff told you?
Yes. And even then I didn't believe them. I could hear them, I mean, I was sitting there, I could hear them saying that I was having a stroke. And I'm thinking to myself, I'm 44, I'm not having a stroke. I just need to go home and have a good sleep. They're going to take me to hospital, they're going to check me out and send me home. And I was in hospital for 3 weeks.
Wow. So tell us a little bit about that. What was happening during that 3 weeks that you were in hospital?
The first few days I was very much sedated because I'd actually had a bleed, and they were very concerned about making sure that, A, the bleeding stopped. They might have to operate if it didn't, just to relieve the pressure, but also obviously to give the brain the best chance to recover. They very heavily sedated me for about 3 days, and then they slowly took me off that, and I started to sort of like be aware of what was going on around me again. I was very heavily monitored, probably for about another week, sort of blood pressure being done every sort of few hours, playing around with sort of different levels of medication to sort of try and get everything under control. And once they felt that everything was a little bit more controlled, then I started on speech therapy, physiotherapy, occupational therapy, and they started to look at what would need to be done for me to be able to go home.
And we'll talk about that in just a second, but one of the things we saw in the film there was about the emotional side, you know, and I'm really intrigued to know how you coped, and because, you know, you're suddenly faced with a life-changing situation. Your family are also facing a completely different Rebecca that they knew. So tell us a little bit more about the emotional side and how you coped with all of that.
I actually think in those early days it's much harder for the family, because as the stroke survivor, you're in the hospital, you're doing what you're told to do when you're told to do it. Everything is very controlled and you're in a bubble. I don't think it hit me until I was at home, and all of a sudden I was back in the big wide world again. So I think in the early days it's very much more the family sitting at the bedside looking at you with tubes and whatever else going on. And they're the ones really need that emotional support in those first few days they're the ones that have got a hell of a lot of information to try and take on board.
And you help with that, don't you, at the Stroke Association? Because you obviously look after the stroke victims, but also the people around them. Tell us a little bit more about how you do that and when you normally get involved.
So we do have resources that are available free to anybody if they want more information, because information at a time that something's happened to your loved one is quite helpful. So we do have our website with a host of different resources. We've got our online digital tool called My Stroke Guide, and there are over 200 videos there that people can watch a range of, get a range of different information on. And there are mechanisms for them to connect with other, stroke survivors. And there's even a section for family members and carers where they can connect and, touch upon issues as a carer, as a, family member and what's happened to their loved one.
Do you automatically get informed when someone's had a stroke to bring you in, or is it a case of somebody actually approaching you once they or their loved one has had a stroke?
So in certain areas, we do have services that are commissioned where we will reach in and work with, health partners, social workers, GPs, various other agencies working with people that have had stroke, and we will refer to one another. So we, could, contact you, or you might see us in the hospital, but that's not available everywhere. So the resources, like we have a helpline that anybody can call. So we do encourage people as stroke survivors, as employers or friends, family members that maybe want to obtain more information and find out how they can better support people, to get in touch. Our website, the My Stroke Guide. So those are available for everybody. And in certain instances, if you contact us, like on a helpline, if there's something extra that we can provide, then certainly we can do that.
And it's great to know that there is that much support. And actually, for you watching at home, if you want to get any of those details, just contact us here at the Islam Channel and we'll be very happy to pass them on for you. And coming back to you, Rebecca, when did you first become aware of the Stroke Association and start to realise that they could actually maybe help you through the recovery stage?
By having a very inquisitive partner who, when he'd spoken to a doctor, might go home and then try and Google what the doctor had told him to sort of try and understand better what he'd been told that day. And one of the first websites he came across was the Stroke Association website. And that became a very good place for information, and that was his go-to place. So if he was asked something, he'd look there first. And
Excellent.
9 out of 10 times we would find the answer that he was looking for.
And that's really what it's about, isn't it? Being able to answer those really difficult questions. You said earlier on that for you a real big moment was going home. Mm-hmm. What sort of advice do you give to people who maybe have loved ones in hospital at the moment, who might be coming home soon or whatever? How do you recommend people deal with that particularly tough time?
It's a difficult one because obviously that person that's been in the hospital, like I said, it's almost like you are in a bubble to an extent, and it will be quite an emotional thing for them to suddenly come home. And again, they have got an awful lot to deal with, and I think it's just being there for them, talk to them, listen to them, and just support them, and no pressure. In those early days, it's got to be one day at a time. I mean, my partner ended up having to take 7 weeks off work to stay at home with me until they felt that, he felt comfortable to leave me at home so he could actually go back to work.
So
it's
there's
a life-changing thing.
Big knock-on effect, isn't there,
Yes.
to all of these things happening? And what about the ongoing emotional support? Because, you talked about the physiotherapy, the occupational therapy and so on. What about the emotional support that was available to you?
To me, one of the biggest support things has been being able to talk to other stroke survivors. I think the peer support is just so important. And I'm lucky that I get to talk to a lot of stroke survivors, and they all say the same thing, that going to a stroke group, sort of just talking to other people is the best thing, and just exchanging stories and advice.
And of course, it's going to be very different for every individual, not
Absolutely.
only in terms of the amount of support they want, the type of support that they want, and of course, they can just pick and choose what suits them. We talked earlier on with Michelle about how the recovery time can be very different. For you, you're now 4 years on. Give us a very quick synopsis of what's happened during those 4 years and how you are now.
Well, I was very lucky, and I always say I know I was very lucky. I was off work for about 4 months. Then I did a gentle phased return to work, which probably took about another 3-4 months, because I really did, and they were very good at letting me take my own pace. And I actually carried on. I went back to my old job. They kept it open for me. I went back there for about another year, decided that I really didn't want to do that anymore. I then decided to do some volunteering and take some time out, and I volunteered for the Stroke Association. And I used to go and do Know Your Blood Pressure sessions. I became a stroke ambassador. And I actually now work for the Stroke Association, looking
Wow.
after the volunteers.
And how do you feel in yourself now? How would you say, for example, there might be somebody, again, watching at home at some point of that 4-year journey. What kind of advice would you give to them to see them through to the next stage of their recovery?
It is one stage at a time. One of the best bits of advice that I was ever told was try not to look back too much and dwell on the past, and trying to get back to the way you were before the stroke, because in 9 out of 10 cases, that really isn't going to happen. And to try and think that it will and sort of really put that pressure on yourself doesn't actually help until you kind of work with, okay, this is what I'm like now, this is what I can do to get better. You need that positive, you need to keep positive. And I was always very lucky. I had a very positive family around me who didn't let me sit and dwell.
And of course, again, everyone deals with this in a very different way. And that must be one of your challenges when you come to training your various members of staff. Obviously, having people who've been through the journey is fantastic. But, you know, approaching people in different ways must be one of those sort of big areas of training.
Yes, so we do provide a range of different kinds of support. So Rebecca mentioned like the peer support being very valuable. So we train up volunteers to be able to, support, carers, family members, stroke survivors themselves, and engage in activity. There is life after stroke. So along with providing peer support, we have groups that are out there doing physical exercise, they're doing yoga, they're going on outings, they're, taking part in, musical therapy and art therapy. So kind of getting involved, being able to feel comfortable and relating to people that may understand what you're going to has been very helpful for both family members and stroke survivors.
And when you talk to somebody who's maybe at the beginning part of their journey, what's the sort of general advice that you give them? How do you sort of, if you like, prepare them for what is going to be quite a journey?
So part of it is kind of understanding what's happened to you and things that you might be experiencing and feeling is normal following a stroke. So not just focusing on the physical aspects of things that you can't do following your stroke, but some people will experience, emotionalism. They might all of a sudden be much more tearful and emotional or less emotional, not being touched by things. One woman told us she lost her ability to understand humor. It could, affect people's, memory, their fatigue, tiredness. And for your family and people around you to kind of understand you're not being grumpy, you're not more miserable following your stroke. That could be your mood having been affected as a result of a brain injury. So kind of understanding what has happened to this person that you love and care for.
And that's a really valid
helps.
point, isn't it? Because of course the stroke victim is at the very centre of the care that you provide, but also helping friends, family and loved ones. That's a huge job.
Absolutely. So you might want to play a supportive role. So for example, if you would like to make better lifestyle choices and perhaps improve the diet, if somebody else in the family maybe has that role of preparing the meals and cooking, if they're not understanding some of the changes that you want to make, and they might need support themselves to, you know, swap things out, you know, make it a bit more healthier, that's something we would like to support the whole unit with. So it is about knowing what steps you can make and changes and being supported to kind of deliver on them.
A massive part of the programme is about prevention as well. And we also know that people who have a stroke, there is a chance that they will have a further stroke. What are the sort of things that you've been doing, Rebecca, to help reduce your chance of another stroke?
Everything that I think was covered earlier to a certain extent. I try and walk regularly, sort of try and get my exercise up. I do check my blood pressure every week because mine was, we think, caused by high blood pressure. So I do check my blood pressure weekly. Diet is obviously very important, and I do try and eat well. It doesn't always happen, but I do mean it's really trying to follow a healthy lifestyle, which everybody should be doing for any reason anyway.
Well, of course, it helps in all areas of our health, doesn't it, if we do have that lifestyle. However, Michelle, we know that the NHS, charities such as yourself, are continually advising us to eat more healthy, look after ourselves. Why are we finding it so difficult when we understand some of the risks that we've been talking about today?
Oh, that's a big question. You know, part of it is it is difficult to kind of break habits, and we do know kind of things that we want to do. And honestly, if I can get back to this peer support element, or just support in general, if your colleagues at work were like, hey, this lunchtime, we're all gonna, you know, go out for a 20-minute walk. You know, if you support yourselves as a wider community and in a network to engage in kind of healthier activities and to make those better choices, you're a lot more successful. I think it's the support element.
That's what makes a big difference. And obviously having organisations such as yourself, and there's so many organisations out there now where there's absolute information available that's going to help people. What are the other things that maybe people don't realise that you do at the Stroke Association? The areas of help that you offer, the areas that you're involved in?
So Rebecca briefly mentioned this as well. We provide a lot of volunteering opportunities. So if you are passionate about wanting to get the message out there, you know, help people understand how they can prevent strokes, we have, you know, roles for that. If you want to work with people who've been affected by stroke and just be maybe a conversation partner and help people improve their confidence in order to kind of return back to work or carry out daily activities like ordering your own coffee, you know, in the coffee shop with confidence, you know, that's a role that you can play. So linking together kind of communities, developing people in the community, whether they want to take on activities, we may support them with, you know, volunteering resources to help set that up. So,
and of course, you're continually, you know, as a charity, trying to raise money, trying to make sure that you have the resources available to do all of this work.
Absolutely. So fundraising is a big thing for us. We are a charity, so all of this activity in terms of funding research, you know, campaigning for better stroke care that benefits everybody kind of in the UK, and all of that relies on the generosity of people kind of donating to our charity.
Well, that's a great way to finish, because we really do hope that people support the charity. We've seen, you know, the fantastic work you've done. So thank you very much indeed, both of you. It's been absolutely great to have you on the show. Thank you.
Thank you for having us.
Unfortunately, that is all time we have time for now, but I'd like to thank our guests, Michelle Dalmasio, for giving us such valuable information, and of course Rebecca Nightingale for sharing her experience as a survivor. We're really grateful to them for coming onto the show and discussing the importance of acting fast. Remember, fast. And also what you can do if you suspect someone is suffering from a stroke. Once again, we must stress that should you suffer from any medical problems or health concerns whatsoever, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. As always, if you'd like to find out anything more about this or any of the subjects we've discussed on the show and throughout the series, then please do email us at healthshow@islamchannel.tv. For now, it's goodbye from me, and thank you for watching. Assalamu alaikum.